Hi everyone, welcome back to my channel. Today we are diving into the world of medical coding with some CPC exam practice questions. Practice is the key to mastering the CPC exam. And guess what? Today we have got a mix of questions lined up for you. Remember, consistent practice can make all the difference in passing the CPC exam on your first try. So, grab your coding manuals, let's get started. Before that, don't forget to hit the like button, subscribe and ring the bell for notifications on our latest content. First question, what parts of the body are examined during a sigmoidoscopy? Option A, rectum, option B, sigmoid, option C, portion of descending colon, option D, all of the above. The right answer is option D, all of the above, because during a sigmoidoscopy, the doctor examines the lower area of the large intestine or colon, which includes rectum, sigmoid colon and descending colon. So the answer is option D. Next question. Which suffix means blood or blood condition? Option A, emia, option B, oma, option C, penia, option D, urea. The right answer is option A, emia. The suffix emia is used in medical terminology to denote an abnormal blood condition. Next question. Let us try to solve this question by using elimination method. That is, before looking at the question, let us look at the options. Let us check the first code from each options. Check option A, first code 11622. That is for excision, malignant lesion including margins, scalp, neck, hands, feet, genitalia. Excised diameter is 1.1 to 2 cm. And in option B, 11626 is for excised diameter over 4.0 cm. And in option C and D, the code 11623 is for excised diameter 2.1 to 3.0 cm. Now we'll highlight the main terms in the question. On January 31st, Barbara had 2 cm malignant lesion excised from her left foot. During a post-operative checkup on February 2nd, a residual tumor was noted at the margin of the original excision and the margins were re-excised. The re-excision included a 3 cm excised diameter. How would the same physician code the re-excision? So here in this question they are asking to code for the re-excision, right? And the re-excision included a 3 cm excised diameter. So which among these three codes is the right one? If you choose 11623, then you're right, because that is for excision, malignant lesion including margin, scalp, neck, hands, feet, genitalia. In the scenario, the anatomical location is left foot. So the anatomical location is correct and the size is 2.1 to 3 cm. Here the size is 3 cm. So it is exactly matching with the code 11623. By this, you can directly eliminate option A and option B, because option A is for 1.1 to 2 cm, but in the scenario, the size is 3 cm. And in option B, 11626 is for excised diameter over 4.0 cm. So that is wrong. In option A, though they have mentioned 11623, we are not supposed to code it with 11622. We have to code for the size specifically. Okay. So eliminate option A and option B. Now we are left with option C and option D. The difference is between the modifiers. Modifier 59 is for distinct procedural service and modifier 58 is for staged or related procedure or service by same physician or other qualified healthcare professional during the post-operative period. So which modifier is matching the scenario? Modifier 58, right? Because modifier 58 is for staged or related procedure or service by the same physician or other qualified healthcare professional during the post-operative period. In the scenario, you can see they have given during the post-operative checkup on February 2nd, residual tumor was noted at the margin and the margins were re-excised by the same physician, right? So we have to use modifier 58, not modifier 59, because this is not a distinct procedural service. To append modifier 59, the documentation must support a different session, different procedure or surgery, different site, different organ, different injury. But in this scenario, we cannot find anything as such, so we'll eliminate option C. The right answer is option D. Let us move on to the next question. This question is not that lengthy, so you can read the question. Dr. Rami, an orthopedic surgeon, removed prosthesis from Cindy's left knee. Dr. Rami inserted a spacer during the same surgery. How would you code for Dr. Rami's services? Let us check the options. Check option A, 27445. 27445 is for arthroplasty knee hinge prosthesis. Example, Waldeus type. Option B, 27310 is for arthrotomy knee with exploration, drainage or removal of foreign body. Option C, 27331 is for arthrotomy knee including joint exploration, biopsy or removal of loose or foreign bodies. And option D, 27488 is for removal of prosthesis including total knee prosthesis, methyl methacrylate with or without insertion of spacer knee. So which among these four codes is the right answer? The right answer is option D, 27488, because that is for removal of prosthesis. Okay, in the scenario also there is removal of prosthesis and there is insertion of spacer during the same surgery, and the code 27488 is for removal of prosthesis including total knee prosthesis with or without insertion of spacer knee. So in the scenario there is insertion of a spacer, so it is matching with the code 27488. We'll eliminate option A, 27445, because that is for arthroplasty knee hinge prosthesis. In the scenario they have not mentioned arthroplasty knee hinge prosthesis, right? So directly eliminate option A, and option B, 27310 is wrong because that is for arthrotomy knee with exploration, drainage or removal of foreign body. In the scenario arthrotomy is not performed, so eliminate option B. And option C, 27331 is for arthrotomy including joint exploration, biopsy or removal of loose or foreign bodies. So that is also not mentioned in the scenario. Eliminate option C. Option D, 27488 with LT is the right answer. They have mentioned LT to denote left knee. Okay. Let us move on to the next question. In this question, the physician performs V-excision of the lip with primary direct linear closure. This procedure was completed to remove a lesion. What code describe these services? Let us check the first codes from each option. Remember, to reach the right answer very fast, you have to start with the first codes from each option. So in option A, first code is 40510. 40510 is for excision of lip, transverse wedge excision with primary closure. Option B, 40520 is for excision of lip, V excision with primary direct linear closure. In option C, again they have mentioned 40510. In option D, there is 40530, which is for resection of lip more than 1/4 without reconstruction. So which among these three codes is the right answer? The right code will be 40520, which is for excision of lip, V excision with primary direct linear closure. In the scenario, they have mentioned V excision of the lip with primary direct linear closure, right? So the appropriate code is 40520. We'll eliminate option A because that is for excision of lip, transverse wedge excision with primary closure, and along with that they have mentioned 40520, V excision with primary direct linear closure. But we are not supposed to code 40510 because that is for transverse wedge excision. It is not mentioned in the scenario. So eliminate option A, and coming to option C, they have mentioned 40525 along with 40510. 40525 is for full thickness reconstruction. So that is not mentioned in the question. So eliminate option C. And option D, 40530 is for resection of lip. But in the scenario there is V excision of the lip. So eliminate option D. Option B is the right answer. Let us move on to the next question. This is a question from HCPCS level 2. Read the question. What HCPCS level 2 code would you report for an intramuscular administration of atropine 0.3 mg. In the options, you can see they have given the code J0470 and J0461. So, first let us check those two codes. J0470 is for injection dimer-caprol per 100 mg and J0461 is for injection atropine sulfate 0.01 mg. So, among these two codes, the right code is J0461, that is for injection atropine sulfate 0.01 mg. So, we'll eliminate option A and C, which has the code J0470. Now, we are left with option B and D. In option B, they have mentioned J0461 into 30. You can see in the question, there is administration of atropine 0.3 mg. J0461 is for 0.01 mg. So, to make up 0.3 mg, we'll multiply it 30 times, we'll get 0.3 mg. So, the right answer is option B. Option D, J0461 will be wrong because that is only for 0.01 mg. Let us move on to the next question. Read the question. A 39-year-old male patient underwent a mastectomy for gynecomastia. His recovery was uneventful. What is the correct code to report the mastectomy? Let us check the options. Check option A 19300, that is for mastectomy for gynecomastia. And option B 19302 is for mastectomy partial with axillary lymphadenectomy. And option C 19307 is for mastectomy modified radical including axillary lymph nodes with or without pectoralis minor muscle but excluding pectoralis major muscle. And option D is none of the above. So, which among these is the right code? If you choose option A 19300, then you are absolutely right, because that is for mastectomy for gynecomastia. In the scenario, you can see the patient underwent a mastectomy for gynecomastia. So, option A is the right answer. Option B will eliminate because that is for mastectomy partial with axillary lymphadenectomy. That is not matching with the scenario. And 19307 is for mastectomy modified radical including axillary lymph nodes. So that is also not matching with the scenario. And in option D, they have given none of the above. But we already got a code 19300, that is mastectomy for gynecomastia. Let us move on to the next question. Read the question. True or false? The following coding combination 31526 and 69990 are correct if reported together. To find the answer for this, you can check the code 31526. Below that, they have mentioned a parenthetical note. Do not report 31526 in conjunction with 69990. So, these two must not be coded together. In the question, they are asking whether the coding combination 31526 and 69990 are correct if reported together. So, the right answer will be false, because we should not report 31526 and 69990 together. Let us move on to the next question. A physician repairs a retinal detachment by depressing a hot probe over the outer layer of the eyeball to seal the choroid to the retina. A scleral buckle is placed around the eyeball to support the healing scar. What code captures this service? Let us check the options. Check option A 67101, which is for repair of retinal detachment including drainage of subretinal fluid when performed cryotherapy. Option B 67015 is for aspiration or release of vitreous, subretinal or choroidal fluid, pars plana approach. And option C 67115 is for release of encircling material, posterior segment. And option D 67107 is for repair of retinal detachment, scleral buckling when performed implant cryotherapy, photocoagulation and drainage of subretinal fluid. The right answer is option D 67107, because that is for repair of retinal detachment, scleral buckling. In this scenario, you can see the physician repairs a retinal detachment, a scleral buckle is placed. So the right code will be option D 67107. We'll eliminate option A 67101 because that is for repair of retinal detachment including drainage of subretinal fluid when performed cryotherapy. But the code 67101 does not include scleral buckling. In the scenario, they have given scleral buckle. So we have to code 67107. So eliminate option A, and option B 67015 is for aspiration or release of vitreous, subretinal or choroidal fluid, pars plana approach. So that is also not matching with the scenario. So eliminate option B. And option C 67115 is for release of encircling material posterior segment. So that is also not matching with the scenario. In this scenario, the physician is repairing a retinal detachment and scleral buckle is placed to support the healing scar. So option C 67115 will be wrong. Option D is the right answer. Next question. A 26-year-old healthy female suffered a cardiac arrest with administration of anesthetic during delivery. What are the correct diagnosis codes? Let us check option A, O74.2. O74.2 is for cardiac complications of anesthesia during labor and delivery. Let us check the O codes in the options first. In option B, they have mentioned second code O74.2. Let us check option C, O74.4. That is for toxic reaction to local anesthesia during labor and delivery. And option D, O74.9 is for complication of anesthesia during labor and delivery unspecified. So which among these O codes is the right one? The right code is O74.2. because that is for cardiac complications of anesthesia during labor and delivery. We'll eliminate option C and D, O74.4 and O74.9, because O74.4 is for toxic reaction to local anesthesia during labor and delivery. But in the scenario, they have given cardiac arrest with administration of anesthetic during delivery. So we have to code for cardiac complications of anesthesia during labor and delivery, O74.2. O74.4 toxic reaction to local anesthesia during labor and delivery will be wrong. So eliminate option C, and option D O74.9, that is for complication of anesthesia during labor and delivery unspecified. So that will be wrong, because here they have mentioned cardiac arrest with administration of anesthesia, and there is a code O74.2 for cardiac complications of anesthesia during labor and delivery. Now we are left with option A and option B. In both the options, the codes are same, but the sequencing is different. So which is the right answer? The right answer is option A, because above the code O74.2, you can see they have given use additional code if applicable to identify specific complication. It means that we have to use additional code. So the O code should be sequenced first. And remember the guideline, O codes have sequencing priority over codes from other chapters. So we have to always sequence the O codes first. That is from chapter 15. Right? And in option A, the second code I46.9 is for cardiac arrest unspecified. In the scenario, the patient has suffered a cardiac arrest with administration of anesthetic during delivery. So we have to code I46.9 to specify cardiac arrest. Therefore, the right answer is option A.